When something goes wrong with our bodies, often we know right away. But what happens when we don't? Atrial fibrillation, or Afib, is when our heart beats irregularly and very fast. And when it's left untreated, Afib can result in a type of stroke where a tiny blood clot stops oxygen from getting to our brain. Now the good news is when this type of stroke occurs, doctors can often remove that clot using minimally invasive techniques, image-guided therapy. But here's the thing, often there are no symptoms with Afib, especially when it comes and it goes. And that is exactly what happened to 56-year-old Marco. You see, when his mom called him one weekend, she immediately noticed something was off. He was slurring his words, and it turns out that he'd had a small stroke. Now normally, doctors will monitor you in a hospital or test you with something called a Holter, which you wear on a belt or on a necklace for 48 hours while it records your heartbeat, trying to catch any occasional brief bursts of Afib. But often 48 hours is not long enough. Well, now there's a new way, using something called a smart patch or an e-patch. What's an e-patch? Well, this is an e-patch. It's a small device that sticks to your chest in just seconds, and it uses the cloud and AI to look for tiny irregularities in your heart, monitoring you in the background for 2 weeks. And unlike that bulky Holter monitor, you can carry on with your normal life. You can do sports. You can even wear it in the shower. And for Marco, his patch meant the difference between living with a big question mark about his condition and being diagnosed and given medication to prevent him from having another stroke. Because you see, on day 5, the patch detected Marco's Afib, which happened just briefly, just for a few seconds, while he was sleeping. But guess what? Clinical studies are now showing that AI could unlock even more. By spotting signs of Afib, signs that are too subtle for the human eye, the e-patch might even predict if you will one day develop Afib. Predicting disease before it happens, so that more people in even more places can get back to living the lives they love. Now that's amazing.
And now you're in the know.